Welcome to our channel. In today's video, we're exploring the topic of vomiting, its causes, and the various treatments available. Vomiting is a common symptom that can result from a wide range of factors, including infections, motion sickness, pregnancy, and underlying medical conditions. Understanding the root causes of vomiting is essential for effective management and treatment. We'll delve into the science behind why vomiting occurs, discuss potential triggers, and provide insights into treatment options and home remedies. Whether you're looking for tips to manage occasional nausea or seeking medical advice for chronic symptoms, we've got you covered. Don't forget to like, subscribe, and hit the notification bell to stay updated with our latest content.
Vomiting is your body's way of hitting the eject button. It's an involuntary reflex, meaning you can't control it. When something irritates your stomach, your brain gets the signal. That triggers a chain reaction, forcefully expelling the contents of your stomach. Think of it as your body's defense mechanism. It's trying to protect you from something harmful. While unpleasant, vomiting often helps you feel better by removing whatever was bothering you. Remember, vomiting itself isn't an illness, but a symptom of an underlying issue. It's like your body's alarm system, telling you something's not quite right. We've all been there, that unsettling feeling that starts in your stomach and can quickly take over your entire body, that queasy sensation that can rapidly escalate to full-blown vomiting, leaving you feeling utterly miserable. But what exactly causes this? One common culprit is food poisoning, which can strike when you least expect it. Consuming contaminated food introduces harmful bacteria or viruses into your system, triggering a cascade of symptoms like vomiting and diarrhea. Another familiar foe is motion sickness, a common issue for those who are prone to car sickness or seasickness. This condition is caused by conflicting signals between your inner ear, which senses motion, and your eyes, which may not perceive the same movement, leading to disorientation and nausea. Infections, such as the stomach flu, are notorious for causing vomiting. These infections often come with additional symptoms like fever, body aches, and overwhelming fatigue. Even stress and anxiety can manifest physically, leading to nausea and vomiting in some individuals. The mind and body are deeply connected, and emotional distress can have tangible physical effects. Understanding the root causes of these symptoms can help you take the right steps to feel better and prevent future episodes. While most cases of vomiting are temporary and resolve on their own, certain warning signs warrant immediate medical attention. Severe abdominal pain, especially if it's localized to a specific area, can indicate a serious condition like appendicitis or pancreatitis. Vomiting blood, whether it's bright red or resembles coffee grounds, is a medical emergency and requires immediate attention. A stiff neck accompanied by vomiting could be a sign of meningitis, a potentially life-threatening infection of the brain and spinal cord. Other red flags include severe dehydration, confusion, blurred vision, and seizures. If you experience any of these symptoms, seek medical help immediately. When a bout of vomiting strikes, there are several things you can do at home to ease your discomfort. Start by letting your stomach rest. Avoid eating or drinking anything for at least 30 minutes after vomiting. Once you feel ready to eat, stick to bland foods like toast, crackers, rice, and bananas. These foods are easy to digest and won't irritate your stomach. Stay hydrated by sipping on clear liquids like water, broth, or sports drinks. Avoid sugary drinks, as they can worsen dehydration. Over-the-counter medications like Pepto-Bismol or Tums can help neutralize stomach acid and alleviate nausea. Seeking medical help. Knowing when and what to expect. Understanding when to seek medical help is crucial for your health and well-being. While home remedies can be effective for mild cases of vomiting, such as ginger tea or peppermint, certain situations require medical intervention. It's important to recognize the signs that indicate a more serious condition. If your vomiting persists for more than 24 hours, you're unable to keep down any fluids, or you experience severe dehydration, it's essential to see a doctor. Symptoms of severe dehydration include dry mouth, dizziness, and reduced urination. During your visit, your doctor will likely ask about your symptoms, medical history, and any recent travel or dietary changes. This information helps them to narrow down potential causes and provide the best care. They may also perform a physical exam and order tests, such as blood work or a stool sample, to determine the underlying cause of your vomiting. These tests can reveal infections, metabolic issues, or other health problems. Treatment will depend on the underlying cause and may include medications to reduce nausea and vomiting, intravenous fluids to combat dehydration, or antibiotics if an infection is present. In some cases, further treatment or hospitalization may be necessary to ensure proper recovery and prevent complications. Preventing vomiting tips for a healthier stomach. While not all causes of vomiting are preventable, there are several steps you can take to reduce your risk. Practice good food safety by washing your hands thoroughly before eating, cooking food to the proper temperature, and refrigerating leftovers promptly. If you're prone to motion sickness, try to sit in the front seat of a car, look at the horizon, or take over-the-counter motion sickness medication before traveling. Manage stress and anxiety through techniques like deep breathing, meditation, or yoga. Avoid eating large meals, especially before bed, as this can increase your risk of acid reflux and vomiting. The mechanics of vomiting, a closer look. Vomiting, while unpleasant, is a complex physiological process involving multiple organs and systems. It begins with a trigger, such as a virus, toxin, or even a strong odor, sending signals to the vomiting center in the brain. The brain then sends impulses to the muscles in your abdomen, diaphragm, and esophagus, coordinating a forceful expulsion of stomach contents. During vomiting, your abdominal muscles contract sharply, squeezing your stomach. Simultaneously, your diaphragm, the muscle that controls breathing, contracts downward, increasing pressure in your abdomen. This coordinated muscle action propels the contents of your stomach upward through your esophagus and out of your mouth. Vomiting in children's special considerations. Vomiting is common in children and can be caused by various factors, including infections, food intolerances, and motion sickness. Infants may vomit after feedings due to overfeeding, reflux, or a milk protein allergy. Toddlers and young children are particularly susceptible to viral gastroenteritis, commonly known as the stomach flu, which can cause vomiting, diarrhea, and fever. It's crucial to monitor children closely for signs of dehydration, such as decreased urination, dry mouth, and lethargy. If your child is vomiting persistently, unable to keep down fluids, or shows signs of dehydration, seek medical attention immediately. The role of hydration and electrolytes. Vomiting can lead to dehydration, a condition that occurs when your body loses more fluids than it takes in. When you vomit, you lose not only water but also essential electrolytes, such as sodium, potassium, and chloride. Electrolytes play a crucial role in maintaining fluid balance, nerve function, and muscle contractions. To prevent dehydration, it's essential to replenish lost fluids and electrolytes. Sipping on clear liquids like water, broth, or oral rehydration solutions can help restore hydration and electrolyte balance. Long-term effects of chronic vomiting. While occasional vomiting is usually harmless, chronic vomiting, defined as vomiting that persists for an extended period, can have serious health consequences. Repeated vomiting can damage the esophagus, the tube that connects your mouth to your stomach, leading to inflammation, ulcers, and even bleeding. Chronic vomiting can also cause malnutrition by interfering with your body's ability to absorb nutrients from food. In severe cases, chronic vomiting can lead to electrolyte imbalances, dehydration, and weight loss. If you experience frequent or persistent vomiting, it's essential to consult with a healthcare professional to determine the underlying cause and receive appropriate treatment. Living with cyclic vomiting syndrome. Cyclic vomiting syndrome, or CVS, is a rare disorder characterized by recurrent episodes of severe nausea and vomiting. These episodes can be extremely debilitating and can significantly impact a person's quality of life. The exact cause of CVS is unknown, but it's thought to be related to a combination of genetic and environmental factors. Research is ongoing to better understand the underlying mechanisms and potential triggers of this condition. Episodes of vomiting in CVS can last for hours or even days, and may be so intense that they require hospitalization. During these episodes, individuals may become severely dehydrated and need intravenous fluids and other supportive care. Between episodes, individuals with CVS typically feel well, but may experience nausea, abdominal pain, or fatigue. These intermittent symptoms can be unpredictable and may vary in intensity from one episode to the next. Treatment for CVS focuses on managing symptoms and preventing future episodes. This often involves a combination of medications and lifestyle changes tailored to the individual's specific needs. Medications, such as antiemetics to reduce nausea and vomiting, and triptans, typically used to treat migraines, may be prescribed. These medications can help to alleviate symptoms and shorten the duration of episodes. Lifestyle modifications, such as avoiding triggers, maintaining a regular sleep schedule, and managing stress, can also help prevent CVS episodes. Techniques like meditation, yoga, and dietary adjustments can be beneficial in reducing the frequency and severity of episodes.